Hey everyone, I'm Megan. Public health might seem dull, but it's a web of mind-blowing connections. Banning smoking does more than clear the air, and legalizing weed could lead to safer roads. Today, we're diving deep into the surprising ripple effects of policies and why things are never as simple as they seem. Alright, let's talk smoking. We all know it's bad for you, right? Like, duh. But when cities started banning smoking in public places, something unexpected happened. Heart attack rates plummeted, like way more than anyone expected. We're talking a 40% drop in some places. 40%, that's massive. So how do we explain this? Imagine this. You're a smoker and suddenly you can't light up in your usual haunts. The office smoke break is gone. Bars and restaurants, smoke-free zones. It's inconvenient, right? And for some people that inconvenience becomes the push they needed to quit. Fewer places to smoke means fewer smokers overall. It's a chain reaction, a domino effect. And that's what systems thinking is all about. Understanding that one change can trigger a cascade of unintended consequences. It's not just about telling individuals to quit smoking, it's about creating an environment where smoking itself becomes less appealing, less accessible. And that, my friends, is how we create lasting change. Think about it. When was the last time you saw a movie character light up a cigarette and thought, wow, so glamorous? Times have changed and these cultural shifts, they matter. Okay, let's move on to another hot-button issue, vaccines. Vaccines are one of the greatest public health triumphs in human history. They've saved millions, if not billions, of lives. But here's the thing. Some of the people who are most likely to refuse vaccines are the ones who benefit the most from them. We're talking about people in wealthy countries, people with access to good health care. When a disease is rare, it's easy to feel like it's not a threat. But here's the catch. That rarity is often because of vaccines in the first place. See, vaccines work on this amazing principle called herd immunity. Basically, when enough people are vaccinated, it creates a protective shield around those who can't be vaccinated, like infants or people with compromised immune systems. But when people, especially those in privileged positions, start opting out of vaccines, they're essentially poking holes in that shield. They're relying on the rest of us to maintain herd immunity while putting others at risk. Should vaccines be mandatory for everyone? Comment below. Weed, alcohol, and the unexpected consequences of legalization. Okay, buckle up, because this next one is a real head-scratcher. Let's talk about weed. Now, we all know that driving under the influence of anything is a terrible idea. But when some states started legalizing recreational marijuana, they actually saw a decrease in traffic fatalities. Yep, you heard that right, fewer deaths on the road. So, what's going on here? Are we all just chilling out and driving slower? First, it seems like some people are substituting weed for alcohol. And let's be real, alcohol is far more dangerous when it comes to driving. Drunk driving is reckless, aggressive. People get behind the wheel thinking they're invincible. Stoned driving, on the other hand, well, it's not exactly a recipe for a high-speed chase. Stoned drivers tend to be more aware of their impairment. And lastly, let's be honest, some people who would have otherwise driven after smoking weed are now just staying home on the couch raiding the fridge. Systems lesson. Policies have ripple effects. Systems thinking, the key to unlocking public health. So what have we learned today? Well, the biggest takeaway is this. In public health, everything is connected. We can't just look at individual behaviors or isolated policies. We have to look at the entire system. A smoking ban isn't just about secondhand smoke, it's about shifting social norms and making it less appealing to smoke in general. Vaccines aren't just a personal choice. They're about protecting the most vulnerable members of our community through herd immunity. And drug laws? They're not just about the drugs themselves, but about how people use them, how they interact with each other, and how those choices impact everyone on the road. Systems thinking is about understanding these complex interactions, these unintended consequences. It's about acknowledging that our choices, our policies, they all create ripples that extend far beyond ourselves. Call to action. So next time you hear a health policy debate, ask, what are the hidden connections? And drop your hottest take in the comments. Should we ban smoking everywhere, force vaccines, legalize weed nationwide, or replace it with a healthy behavior? Let's argue. The conversation continues. That's it for today's deep dive into the wild world of public health. Massive thanks to Dr. Mohammad Ismail Zubair, MD, MSc, Mississippi, PhD candidate, for his incredible work in public health research. Go check out his stuff, it's mind-blowing, and if you're as fascinated by these hidden connections as I am, hit that subscribe button. We've got a whole lot more mind-bending science coming your way.